Welcome. My name is Deneen Saccone, and I am the Policy and Advocacy Lead for the Coalition to End Social Isolation and Loneliness. I am joined by Abby Gadboy, Policy Manager for the Coalition. We want to walk you through the Coalition's 2023-2024 policy goals and invite you to join us in taking action to reach them. The Coalition is a diverse group of stakeholders whose mission is to increase public awareness, promote innovative research, advocate for policy change that combats the adverse consequences of social isolation and loneliness, and advance approaches that improve social connectedness for all Americans. As we emerge from the COVID-19 pandemic with its waves of isolation, disconnection, and loss, the Coalition's mission becomes critical, now more than ever, in grounding ourselves in meaningful connection, resiliency, and belonging. The Coalition has been advocating for policy change to address the adverse effects of social disconnection since it was formed in 2018. We know that social connection impacts people across all aspects of their lives, where they live, work, worship, and play. Therefore, solutions must be multi-sectoral across various levels of influence. We will cover the policy goals at a high level, but encourage you to download the full report on our website and consider some of the recommendations to achieve our mission for the health and well-being of all of us. Let's get started. Our first goal is to increase public awareness regarding social isolation, loneliness, and connection, and their effect on health, belonging, well-being, and resilience. We must increase awareness and understanding of social isolation and loneliness, as well as highlight solutions to promote social connection. Increasing public awareness will have a force multiplying effect on our other policy goals, such as improving access to and uptake of relevant services and supports and promoting research. Next is enhance social services and supports to address social isolation, loneliness, and promote social connection. Although solutions to address social isolation, loneliness, and connection will vary, they should take into consideration and leverage existing social services and supports. This is very timely with the recent interest in addressing health-related social needs, such as housing and transportation, and drivers of disparities. To help support this, many of us are beginning to identify and promote community-based programs and interventions that foster social connectedness. In the workforce, programs that connect young adults to meaningful and rewarding careers can serve as a pathway to financial security and establish professional networks that help foster lifelong purpose, belonging, and well-being. Education is a key component. Expanding access to quality higher education and vocational opportunities can provide young adults with the skills and experience they need to enter and establish careers in high-demand jobs. We have also focused on nutrition. It is essential to combat loneliness that we continue to provide access to resources that help individuals fulfill their basic health needs and support their overall well-being, as well as reduce financial stress due to food insecurity. Investment in community environments, infrastructure, and technologies will develop accessible community spaces and platforms for individuals to gather and form social connections. Caregivers are another at-risk group that encompasses millions of Americans who provide care to their children, aging family members, and other individuals with disabilities. The act of providing care can be very fulfilling and meaningful, but without adequate support financially by their employer or with additional needs, they can become isolated, lonely, and depressed. Finally, we want to encourage and facilitate individuals to engage in civic activities to strengthen their communities and develop leadership skills. In doing so, they build social ties, trust, and cooperation between community members, community-based organizations, and agencies. Our third goal is advance health services and supports to address social isolation, loneliness, and promote social connection. Social isolation and loneliness can take a toll on our physical and psychosocial health. It can lead to poorer health and well-being, higher healthcare costs, and more deaths. Social connection or lack of social connection can lead to positive or negative physical, emotional, and or mental health effects. Whole person care can incentivize strong collaboration across the health and social sectors to improve an individual's well-being and social connectedness. Expanding benefit coverage is critical. Inclusion of social connection benefits in Medicare and Medicaid will help ensure access for those who would benefit the most from these solutions. Just as important is the inclusion of a system and standard screenings, assessments, and evaluations of social isolation and loneliness to provide critical baseline data, identify opportunities for future interventions, and help evaluate solutions as they are implemented. Next is leverage innovative solutions that foster connection and social integration. Recent advances in technologies and innovative solutions hold promise to connect individuals with people, services, and programs. Continued innovations in telehealth, social media services, assistive devices, and other consumer solutions holds potential for addressing social isolation and loneliness. However, we also caution that technology may also lead to an increase in an individual's sense of isolation, particularly among teens and younger adults. As we continue to move beyond the COVID-19 public health emergency, there is a renewed need to develop and support safe spaces and events for all individuals and communities to connect in person. Finally, we have committed to advancing research to establish the prevalence of social isolation, loneliness, and connection. The Coalition's policy goals and strategies are informed by a robust evidence base about the effects of social isolation and loneliness and interventions that promote social connection. Research on social connection should be funded to similar levels as health concerns such as diabetes and smoking.
Hello, my name is Abby Gadboy, Policy Manager for the Coalition to End Social Isolation and Loneliness, and I would like to take you through a few examples of actions that can be taken at the federal policy level. To support goal number 1, create a national coordinator of social isolation and loneliness to lead and coordinate national efforts to reduce stigma and encourage social connection. In support of goal number 2, support social prescribing practices in medical institutions to refer patients to community-based resources such as legal guidance, financial support, housing assistance, food security, time and nature, arts and culture, and volunteer opportunities. To support goal number 3, expand innovative state initiatives and support Medicaid flexibilities addressing social determinants of health, or SDOH, which influence the prevalence of social isolation and loneliness. In support of goal number 4, direct funding to states and local communities to incentivize utilizing shared use agreements to increase access to community spaces for recreational activities. And finally, for goal number 5, amend the Public Health Services Act to include required research and survey items related to an individual's social health. Bolster nationwide screening and surveillance efforts for social connection through prioritizing specific items related to social isolation, loneliness, and connection.
Thank you so much for watching. Again, we encourage you to visit our website to download our full policy agenda brief. We also want to personally invite you to become involved, help the cause with a donation, or reach out to the Coalition for more information.